Hello and welcome to the continuation of Chapter 15, Blood Vessels and Circulation. When I left you last, we'd already talked about the pulmonary circulation and we were looking at the cardiac circulation, one to the head. We talked a little bit about the legs and the fact that it goes from the aorta, down the descending aorta into the iliac, then femoral, and all the way down to the toes and back up again. Now I want to focus on the circulation that goes to the internal organs. And this circulation is called the hepatic portal circulation. So when you look at the hepatic portal circulation, what you're noticing is that there are veins that pick up the blood from the colon and the small intestine, and then it goes into the liver. So all the organs, the spleen, the stomach, the colon, the small intestine, the large intestine, will drain into the liver to be filtered before it continues and joins the vena cava. This is called the hepatic portal system because the system ports it to the liver. And in the liver is where there's detoxifications that occur, different metabolic processes that are occurring. So it'll take down all that broken down nutrients from the intestinal organs and take it to the liver. And this is why if you're consuming a lot of alcohol, one of the first places that alcohol gets processed is in the liver, and you'll get fat in the liver, which leads to hepatic cirrhosis of the liver. Okay, liver, very important in processing and filtering that blood. Another system that I want to look at, you don't necessarily need to know the names of it, but I want you to be aware of what's called the circle of Willis in the base of the brain. So here's the brain, here's a cerebellum, this is the spinal cord, which leads to the pons and the medulla. And there is this basal artery, or the artery that comes off, and notice that there is a circle here. So this allows for a process called anastomosis, which means there's more than one way to get blood to the brain. Anastomosis is any communication with between two vessels. So this happens in the circle of Willis in the base of the brain. The pulmonar arch, which is in your foot, mesenteric arches, which are in your mesentery, your guts, and your arterial arches. The reason behind this, you don't need to know this list, but the reason is communication in two vessels. So this way there's more than one way to get it there in case there's any sort of complication with it going one way. So there's a second path. Okay, now we have looked at systemic vessels. We've looked at the hepatic portal, which carries the blood from the abdominal organs to the liver. We've looked at the circulation physiology. The whole idea of the circulatory system is to exchange oxygen in, good, carbon dioxide, bad, take that away, and other substances generated by the cells. This could be urea, other waste products taken away. Now, the whole idea too is to also have your tissue fluid, which is called your interstitial fluid, is your medium for exchange. So your capillaries is where the diffusion takes place, and by the process of diffusion, things move. Now, you also have blood pressure. Blood pressure will move materials into the tissue, and you have osmotic pressure, which will pull the material from the tissue back into the capillaries. Now this changes as we look on it. It's kind of confusing, but you need to realize that as the blood pressure goes through the capillary bed, the pressure will drop. So on the arterial end, you have high blood pressure. On the venual end, you have low pressure. So on the arterial end, the blood pressure is pushing the fluid out of the capillary into the cells around it. And this is called the interstitial fluid. Inter meaning around. Interstitial fluid is the fluid around it. Now we'll talk about the lymphatic vessel as being an extra collecting system in chapter 16, which we'll do later on. So as the blood comes from the heart, it's under high pressure. The blood pressure will push the fluid out of the capillaries. The blood cells, the white blood cells, will stay in, and the proteins stay in, the large proteins. You merely have the water going out, and you have oxygen and carbon dioxide exchanging. Noticing that your red blood cells stay. Your white blood cells can leak out if your vessel has been activated to be leaky by the immune system. So as you go from arterial end to venual end, the blood pressure drops. So the pushing out force is great at the beginning of the capillary bed and is low at the end of the capillary bed. Now, there is a drawing in pressure, and that is the osmotic pressure. The large blood cells and the large proteins do not leave the blood vessel. As a result, they have what's called osmotic pressure, or a higher concentration of non-water particles will cause water to pull back in to dilute it. So the pull back in is due to the proteins and the blood pressure, and that's called, the proteins and the blood cells. That is called osmotic pressure. The osmotic pressure decreases or increases a small amount as you go through the capillary bed, but not a large amount. However, because blood pressure is the big push here and a little push here, at the end of the venual end, there's less push out and more pull back. So the fluid which came out to wash the cells around is now pulled back by osmotic pressure. And as it's pulled back, it will increase the fluid in the capillary. Okay, so to recap, blood pressure pushes it out. Blood pressure drops, and osmotic pressure is now, although it stayed the same, osmotic pressure becomes a larger factor to pull the fluid back into the venule. There is an extra set of vessels, these closed end vessels that are green. These are the lymph system. The lymph capillaries are quite similar to veins in the fact that they're very leaky, and they have valves in them. We'll talk about that in chapter 17, but these will pick up extra fluid. That's why you may have heard of lymph nodes. Your lymph nodes swell when you have a lot of fluid, or if you ever have a massage, they always massage towards your heart. That's because it pushes along this lymph fluid in your vessels. Okay. When you look at the dynamics of blood flow, there is something called a precapillary sphincter. Sphincters are circular muscles. Precapillary sphincters are sphincters before the capillary bed. They allow you to open up the capillary bed if you want a large amount of flow through here. If you don't, it shuts down. An example is during digestion. Once you've eaten, you want to open up your capillary beds in your gut so that you're picking up all that nutrients. Once you're done eating, and if you're running or exercising, you shut down or constrict these precapillary sphincters, decreasing the fluid that goes through the capillary bed. If things are made larger, they're called vasodilation. Dilation is bigger. Constriction means they're made smaller. Good. Now, returning blood to the heart. You may have had this idea where if you get up too quick, you're lightheaded. That's because your blood needs to be pumped back to your heart. This is pumped due to the constriction of constriction of skeletal muscles pushing the blood to each valve, sort of like a lock in a chamber. And also as you breathe, the breathing motion of your diaphragm and your intercostal muscles is also pushing the blood back towards your heart. Let's look at an example here. Your blood, due to gravity, will be pulled down to your feet. Then as it has gone through the capillaries, it loses blood pressure. So it now has to be pumped back. It is pumped back by the contraction of your skeletal muscles. So the blood will go to about here, your muscles contract, and it pushes a little farther. This is an extreme because your gastronemics are nice and large, but most of your blood vessels, your veins, are beside a skeletal muscle. As that skeletal muscle moves, it pushes back. That's why if you ever have numb or tingly hands, you contract them or you wiggle your toes to get the blood back up to your heart. Your pulse. The pulse that you feel has to come off an artery, and it's due to your ventricle contraction, which is your heart beating. It is a wave of pressure. It begins at the heart, travels to the arteries. So your arteries have the pressure in it. Your veins do not have pressure. You cannot take a pulse from your vein. Also, if you see in those lovely slasher movies, they will just make a light cut and your blood spurts. That is wrong. Your arteries are usually deeper and your blood spurts because of the pressure of your heart. If it's not spurting and oozing, then you have a vein and not an artery. Okay? Your pulse is influenced by body size, gender, age, muscular activity, your emotion. If you ever get excited, or it speeds up. Now, your blood pressure is the force exerted by the blood against the blood vessels. It's determined by cardiac output, which is determined by heart rate and contraction. And it's also a result of your resistance to blood flow. This is a pretty confusing looking chart or graph, but what it basically says is in your aorta, you have a large blood pressure, which makes sense. It just came from the heart. As it goes through your capillaries, it drops, it drops, it drops. It goes back to your heart, very drop. There's a little blip here because your breathing can give it an extra little pump. Your blood pressure is dropped in your veins. That's why it has to go back by another way. Resistance to blood flow. Peripheral resistance is affected by vasomotor changes, which is the pumping in your heart. Baroreceptors have to do with stretch receptors, elasticity of the blood vessels. As you get older, it will decrease the elasticity of your blood vessels. Viscosity, which is the thickening of the blood, and your total blood volume. Blood pressure is taken using a sphygmomanometer or a blood pressure gauge. You'll learn that in clinical. Hypo means low, hyper means high, and you'll learn that in clinical. Now, quick look at vascular disorders. Pretty much you can have clogging of the arteries or arteriosclerosis. What happens is a clot or a plaque gets in there. It interferes with the diameter. It also interferes with the elasticity. Flow is bad. You can have an aneurysm. An aneurysm is when a blood vessel bursts. This can cause a stroke. Strokes are problems in your head. This is the cerebral. Then varicose veins really don't affect you physiologically, but they look ugly. If you want a scary story about surgery in varicose veins, let me know. I've got the scars to prove it. Don't do it. That's pretty much the theory here. Pay attention to your word anatomy. Brachio is arm. Cilio is abdomen, entero, intestine, phrenic, diaphragm. Realize your diaphragm is on top of your digestive organs, very important in breathing. Sphygno has to do with pulse, and pleb has to do with veins. So if you're a phlebitis, you have an inflammation of the vein, and a phlebologist, you take blood. And that's it for blood vessels and arteries and veins. Make sure you memorize those two diagrams. Bye.